Hi all, I am Dr. Selina McGee. Thanks for joining us and tuning in. So I thought I'd spend a few minutes just talking about what's exciting and what's different in the way that we approach dry eye. And when we think about, there was, 3 medications that got pulled across last year alone in the anterior segment space. So I thought I would just kind of walk through like my thought process and how I approach dry eye differently and why it is changed and why it's really exciting, 20 years later from where I started, where we didn't have a single medication approved for dry eye disease, and now we have multiple things. And I think what's really important is knowing and being intentional about how we manage our dry eye patients. And now we have different therapeutics to treat dry eye in a much more targeted way. Because as we know, dry eye disease is multifactorial. We need to start at the outside of the patient and looking at their eyelids, how the eyelids interact with the front surface of the eye, what the lashes look like, how much lid laxity is there. All of those things we need to start on the outside and then work our way to the front surface. And now that we have, a medication like Xdemvy to treat Demodex blepharitis, that's a targeted approach that we can utilize for those patients with Demodex blepharitis. And when we look at dry eye on the ocular surface and we look at the different therapeutics, I think intentionality and that targeted approach is so valuable because we can treat the patient if they have inflammation. We can manage that with a steroid and an immunomodulator. We can look at long-term, how are we going to target evaporation? And now we have a semi-fluorinated alkane that can help us in that realm. We have different molecules and different vehicles to deliver medication to the ocular tissues in dry eye disease. And then not to mention, we have some new data around interventional dry eye therapies. And when we look at the publication last year of the Sahara trial, looking at interventional dry eye with tear care, using it against the gold standard of Restasis, we know that interventional dry eye should be utilized earlier in the disease process based on that data and based on my clinical experience too. And so I think that terminology and really focused on interventional dry eye alongside our therapeutic options that we now have allows us to be very specific and very targeted with our dry eye patients. And we've never been able to treat dry eye like this. And it's so important because dry eye disease affects the quality of life of our patients. It's just becoming more and more because we're asking our visual systems to do more and more. And the fact that, you and I are doing this right now on a screen is what the rest of the world is doing. And so it's really exciting to see that we have more tools available. We have more things coming. I mean, when we look at Lacrofill and being able to use a filler in the punctal system so that we can keep things where they want to be and the medications that we utilize on the front surface, there's some new and exciting things happening in that space too. All that to say is dry eye is really exciting. Take a step back and look at how you're approaching your dry eye patients and really modify your protocols to be able to utilize these different therapies and different interventions to approach your dry eye patients in a very targeted way. Thanks for coming and thanks for joining in. Good to see you guys.